Namaskar, welcome. This is Pia. Today we have with us Dr. Bijal Parikh, who is a renowned plastic surgeon specializing in aesthetic and reconstructive procedures with a practice based at his own hospital, Curves and Cure Cosmetic Clinic in Ahmedabad. Dr. Parikh is committed to helping patients enhance their natural beauty and regain their confidence. With his expertise and artistic approach, he has transformed the lives of numerous individuals, providing them with personalized and exceptional care. And he is also the incoming president of Gujarat Plastic Surgery Association and has also attended as well as arranged many international conferences of plastic surgery. So let's welcome Dr. Bijal to ITV Gold. Namaskar, welcome. How are you today?
All fine, and greetings to all my viewers. Very happy to meet everyone in this TV channel.
Thank you.
Let me tell about myself. I'm Dr. Bijal Parikh, plastic surgeon, practicing in Ahmedabad, and I'm a senior consultant at Zydus Hospital, that's the best hospital of Gujarat. And I have my own setup where actually I have started with general plastic surgery. I was doing all type of plastic surgery, including free flaps, microsurgery techniques, everything. But since last 4 years, I have committed to only aesthetic surgery now. Because that I can say that was my first love. So now I am doing only cosmetic surgery, and very happy to meet you all.
Absolutely, same here, and it's a pleasure to have you in the studio with us. So, you know, as you definitely did share a bit of your background, but I still want to know what inspired you to become a plastic surgeon.
Probably I'm more of a art lover, and from beginning I was happy to see all the different sculptures and everything in all old temples and old monuments of India. So from that I always more into art. Definitely I don't know much about the typical Indian arts, but definitely I was inspired by that, and I have chance to do that artwork on human bodies. So I think I'm more happy in that sense.
You know, I think plastic surgery, definitely it needs a lot of work. So tell me, like, how do you stay up to date with the current techniques and advancements in this field?
You are very right in that, because we have to regularly update ourselves. I used to attend many international conferences and the local conferences, and I have always tried to buy new machines, the latest machine which can help my patient, which can give good result to my patient, and the early result. I would say that the early result with no downtime. So definitely the cosmetic surgery needs more investment as well as even knowledge. You have to invest more and more in knowledge, and that's how we can help our patients.
Absolutely. Since you're talking about, you go to a lot of conferences and stuff like that. So tell me, in your opinion, what are some of the emerging topics and trends that are gaining attention, especially in this field?
As I have more confidence in a new machine. That's a body tight machine. At present, I have just bought that machine since last 5 months. That machine is just started from 2017. It is an American Israel machine, and as we all know that the major cosmetic surgery procedure is the liposuction. That's body for a curve, which increase the curves of your body. It define your curves of your body. So this machine, what we do, previously we were doing just liposuction. We just remove a fat and give a shape. But sometimes because of that surgery, because of that liposuction, removal of fat, sometimes what happens, the skin becomes loose. So to give that wrinkle-free result, this machine I have bought, and that gives a really good result. It removes the fat as well as it tightens the skin. अगर हिंदी में बताया जाए तो ऊपर और अंदर और बाहर दोनों तरफ से वो इस्त्री कर देता है.
Wow.
तो स्किन को वो it tightens the skin, and the skin becomes a absolute wrinkle free skin. So that gives a better result. And the biggest advantage, there are some patients, like in a facelift, if we talk about the facelift, then normally the ideal patients are normally 60 to 70 years plus. But if we say that you will need this much big scar on your just around your ear, and then we'll tighten a skin, then definitely they will थोड़ा सा घबरा जाएंगे वो patient.
बिल्कुल.
So this machine, by this new technique, I just made a small hole and I just tighten a skin. So skin contraction is there, skin tightening is there, and that gives a perfect result. So overall, certain patients from 50 to 70, we can now advise this new technique, and patients are more happy. And I think I have more reliance. Even this technique we can use in all liposuctions, for arms, for abdomen, for hip, thigh, calf, all the areas. Wherever there is a fat, we can remove and we can tighten that skin. So it's a wrinkle-free surgery and minimally invasive liposuction, we can say, with skin tightening. So definitely I have more confidence now in this surgery.
Perfect. You know, since you're talking about like age is like between 50 and 60, so like are those the potential candidates who should be thinking of doing all these things? Or like even earlier, some people may want to, especially, you know, I would call, say, people doing in modeling and fashion. Do you think, what is the age group?
Normally, if we can say that normally 40 to 60. After 40, people definitely they normally they come after 40, because till that they are busy in their family, their progress and everything, and after 40 they have their own money to get this done, and definitely after 40 they used to come. And between 40 to 60 I have maximum patients mainly. And if we say male and female ratio, then the female is probably 60% and male is 40%.
Male ज़्यादा ध्यान नहीं देते.
Male अभी ज़्यादा ध्यान देने लगे हैं, पहले नहीं दे रहे थे. They were just only 20%, but now I'm seeing that since last 5-7 years, the male patients are more. Now it is increasing, and now they also, I think, मुझे लगता है कि अभी मेल और फीमेल अगर हस्बैंड वाइफ को देखो तो दोनों सरखा खर्चा सेम एक्सपेंस कर रहे हैं अपनी अपीयरेंस के लिए. सो दैट्स अ न्यू ट्रेंड डेफिनेटली.
But do you think, like, especially males, you know, earlier we would not see males in this kind of stuff or even thinking about it. Do you think they're getting more aware?
Yeah, definitely they are more aware. But highest, I can say that in a cosmetic surgery, though, maximum for a male, it is a hair transplant. Achha. Maximum patients of a male, they come for a hair transplant. Probably that's the most booming market as of now. And definitely that is also we offer at our place. And for a male, probably the first is a hair transplant. Then comes a liposuction. Gynecomastia is very common. Gynecomastia in male is very common, and now it is because we do it again with a scarless or a minimal scar method. So people are more and more people. The thing is, in cosmetic surgery, I can say that it is being done since last 50 years. But because of these new machines, new inventions, new techniques, probably मुझे लगता है जो स्कार कम से कम छोटे जो आ रहे हैं, इसकी वजह से ज़्यादा लोगों का भरोसा बढ़ रहा है. So now more and more people are coming for a cosmetic surgery. Definitely, probably एक चीज़ I can say that in India that people still don't discuss in people. थोड़ा खुल के लोगों को बता नहीं रहे. थोड़ा बहुत it is in India, it is definitely थोड़ा सा privacy is there in India. But now it is, people are open up. Now it is not there. It's improving day by day.
So since, you know, you are talking about India, and India is one of the hot spots when it comes to plastic surgery. So tell me, how do you compare the global scenario? Like, you know, you visit every place in the world. So how do you compare it?
Probably I can say if we compare with the USA, तो India में शायद अभी we are just 10%. US में highest हो रहा है. The thing is the population is less, but people are more aware. And in India, metro cities and second metro cities, it is increasing. Definitely in a middle class of villages and small places, they are coming. But definitely the less number in India. So there are, now it is progressing because of all social media and the TV and everything. So now people are coming up. But if we compare with the other part of the world, then India is just started. But now we have more and more new machines, new techniques, so people have more confidence. So now we can say that every year we are getting so many patients from USA, UK, Africa, maximum from Africa, so all from Australia, everywhere. Probably we can say लाइक आई एम फ्रॉम अ गुजरात, तो गुजराती लोग जो होते हैं वो गुजरात में आना पसंद करते हैं. जो लोग साउथ इंडियन से दे गो टू बेंगलोर, मद्रास, एवरीवेयर. सो मोर एंड मोर पीपल आर कमिंग टू इंडिया फॉर दिस टाइप ऑफ सर्जरी. Probably one reason is definitely the expense is much less than other part of the world. So that is also one reason. And second thing, the same technique, probably same technique we are using, and same post-op care, same instrumentation, everything is increasing. So definitely more and more people are coming now to India.
Wonderful. So let's talk about curves and cures. So tell me, what kind of, I would say, procedures or range of procedures you have there. Can you talk a little bit about that?
At Curves and Cure, mainly I'm doing all the cosmetic surgeries only. We have indoor facility and all the laser machines, all the machines related to cosmetic surgery, liposuction. My main surgery, probably I can say, that is a liposuction. So we do a maximum liposuction of the abdomen, chest, for gynecomastia, for arms, hip, thigh, calves, every areas. We do by that body tight machine. So immediate tightening is it gives immediate tightening effect. That is my main surgery. Another is for bigger belly, like mummy makeover surgery. We can say mummy makeover because once the female having a marriage and kids and everything, their body becomes loose at certain portion. So we offer all the surgeries for the mummy makeover. Some female may require a tummy tuck surgery. Tummy tuck surgery, in that we have a incision on the lower abdomen, like a cesarean incision, and we reduce extra skin, extra fat, everything, and we tighten a muscle inside. So that gives a perfect tight abdomen, lower abdomen. The mainly surgeries are the cosmetic surgeries of the breast. We do all the reduction, mammoplasty, the implant surgeries, everything we do at our place. And we use everything advanced in the world, like we got the implants, the breast implants from the European countries and US countries, and we use the same thing. Another main surgery is a hair transplant, which is the most common for male patients, and we are regularly getting that patients. Facelift, definitely now we have increased this number of facelift because of that machine, and minimal invasive techniques. So these are the surgeries we normally offer. People used to come for even an eyelid surgery that we call a blepharoplasty. Like you have a baggy eyelids on the upper and lower eyelid, then it looks something like tired appearance of a face. And if we do that surgery, then definitely people will, the patient will look more and more fresh and young. So these are the common surgeries we offered at our place. And small scar revisions, old trauma surgeries because of trauma and anything, all scar on the face, and we correct that deformity also.
As you're talking about it, it looks like I'm inside thinking I need all of them. So tell me, are there any unique challenges or opportunities specific to plastic surgery practice in India as compared to other countries?
Overall, not much difficulties, because our patients in India, probably they come with all the faith in doctor. That's the biggest thing I can say for Indian patients. And my technique, I am more approachable. I always give my number to my patients. I always say that just please don't call me, just text me. I will call you from my side. But so I always try to become approachable to all my patients in any time. So I don't have much problem from a patient side, but definitely challenges is mainly the cost. And now our patients from small places, small villages, they used to come there. Sometimes they come with a more and more irrational expectations.
Yeah.
So that's the biggest problem in India probably. They expect too much, which is irrational, probably which is not possible. So I usually give at least 1 to 2 consultation before surgery. First of all, I give the full procedure information, everything, then tell them you come again, go through Google and whatever, and come again with all your other complaints, difficulties, all your queries, and we will discuss everything before surgery. So definitely they have a more and more satisfaction,
So that
and
they are
usually
also
I have to
clear.
match with the expectation. That is my practice. So I always try to match with the expectations. So probably there are difficulties, but we have solutions for that. The thing
Perfect,
is.
perfect. You know, since you were talking about the cost, and earlier also you said that India definitely is cheaper than a lot of other countries having plastic surgery done. So tell me, you know, if you're talking about cost, what kind of cost if a person wants to go from here to India to get it done to your place? So what kind of cost should they be looking for?
If we consider like liposuction for abdomen area, one area abdomen, then probably it is 1/5 from the cost which is offered here. So India is definitely still a cheaper option, and definitely up to the mark technique and everything if we compare with the US. So definitely it's 1/5 of the cost what
Wow.
we used to.
Wow, that's really amazing. That is really amazing, and of course, you know, let's talk more, and you know, I want to definitely know more. So tell me, what's your opinion? Like, what are some of the like key factors that have contributed to the growth of and development of plastic surgery in India? You know, making it like everybody wants to go, किधर जा रहे हो? मैं India जा रहा हूँ, क्या कराने? You know, either it's plastic surgery, either it's something else. So they just want to go to India.
जैसे मैंने पहले भी बताया कि द थिंग इज नॉर्मली व्हाट हैपन द नॉर्मली from US we get a patient like Gujarati patient came to the Gujarat, the South Indian patient go to the Madras or a chain Bangalore or Hyderabad, like Maharashtrian or from Middle East patients, they usually go to the Delhi or Bombay. The thing is in India we learn, we update ourselves regularly, and we have more and more contacts with all our patients, and they used to send, very frankly, I believe in only one thing: if you satisfy one patient, they will bring another 5 patients.
Perfect.
If one patient is unsatisfied, they will stop another 100 patients. So it's a 1:20 ratio. So I always try to give maximum to my patients, and that's the only thing why patients are coming, more and more patients are coming. And probably another thing is social media marketing, and people are aware of everything in India, and like this TV channel and everything, they definitely boost up everything. So I think that's the reason why we get more and more patients, and people are coming regularly there. I think only this lockdown period. I think in lockdown period I did more cosmetic surgery.
But do you? I thought. Do you think like lockdown period, like it had like kind of stopped people from doing all these, or you
But
think?
Indian people at that time, definitely from outside country, people were not coming in India. But in Indian patients, they were, because वो लोग सोचते थे कि वैसे भी घर पे ही बैठे हैं तो कुछ करवा लेते हैं. तो उस टाइम probably I did more cosmetic surgeries at that time, कि वैसे भी घर पे बैठे
थोड़ा चेंज हो जाएगा.
टाइम पास हो जाएगा. So
Yes.
probably in lockdown I did more cosmetic surgeries in that time.
But you know, it's really nice to hear you. So I want to ask you, like, what do you find most fulfilling, you know, about working as a plastic surgeon, and particularly at your own place?
Actually, the satisfaction on the patient's face, which is the mainly my always aim for my practice. Or if I, for every surgery, probably a gynecomastia surgery, like gynecomastia. If I can explain, that's a male breast. We can say there is a fullness on the chest area of a male, and they are more become more shy and introvert in their routine life. तो मैंने जिसकी भी गायनेकोमास्टिया सर्जरी की है, दे आर एक्सट्रीमली हैप्पी because then they start going swimming, gymming.
They're more confident.
You are more confident in their
Yes.
practice.
Yes.
Like nose surgery, the rhinoplasty surgery. If we do a if you have a we can say कि ये वर्ल्ड में हर 5 में से एक आदमी ऐसे समझता है कि मेरा नोज अच्छा नहीं है.
बिल्कुल.
Every 1 in 5 they feel that their nose is not good. एक बार वो नोज करवाता है, then definitely अगर वो अच्छा हुआ उसके एक्सपेक्टेशन के मुताबिक, then they are more confident in their life. तो जब भी ऐसा कुछ देखते हैं, they give a writing to us कि you need a magic, and तो वो बहुत अच्छा लगता है.
No, I mean that's true. You know, if you in everyday life also, if you look good, you're more confident. You want to be out, you want to look good. So that boosts your confidence. So tell me, how do you maintain a balance between, you know, achieving your aesthetic goals and promoting overall well-being in your patients?
The main thing, probably I say that my approach to my patients, I'm always available to my patients. I always give my number so they can text me for their queries. And I think just like a gynec practice, normally इंडिया में कैसा होता है कि gynec practice में जो ग्रैंड मदर जो गायनेकोलॉजिस्ट के पास गई होती है ना, उसकी डॉटर भी वहाँ जाएगी और उसकी डॉटर भी वहाँ जाएगी. सो नाउ आई एम सीइंग 3 जनरेशन इन माय प्रैक्टिस.
Wow.
So that's probably a new thing for me. So the patients are that much happy with the cosmetic surgery or my approach, whatever, that they refer their blood relations, their near or relatives to me. So probably that's a more satisfying to me. और practice शायद ऐसे ही चलती है.
Exactly. तो अगर हमारे like ITV Gold के जितने भी दर्शक हैं, if they want to contact you and want to get more information, where can they do that?
The best thing is my website, bijalparikh.com. It's my website. So if you go to the www.bijalparikh, bijalparikh.com, my all information is there. You can contact me there, and that's the way.
Perfect. मेरा आखिरी सवाल बहुत ही like ये क्या बोलते हैं 1000 आने का सवाल है कि what I would say advice would you give it to individuals who want to get plastic surgery done, and why should they choose Curves and Cure?
मैं ऐसा तो नहीं बताऊंगा कि कर्व्स एंड क्योर ही चूज करो, कोई भी चूज करो, लेकिन अच्छी जगह पे जाओ. आई थिंक आई वुड से दैट द मेन थिंग, आप जो भी प्लास्टिक सर्जरी करवाना चाहते हो, जस्ट यू शुड टॉक विथ योर डॉक्टर वेरी फ्लुएंटली. आपका जो एक्सपेक्टेशन है वो उसके साथ डिस्कस करो, और एक्सपेक्टेशन जो भी है वो रेशनल होना चाहिए, नॉर्मल, जो नेचुरली. सी इन माई प्रैक्टिस व्हाट आई ऑलवेज से टू माई पेशेंट कि मैं अगर नोज़ बनाऊंगा, नोज़ जॉब करूंगा, राइनोप्लास्टी सर्जरी में करूंगा, तो वो नेचुरल नोज़ रहेगा, ऐसा ही बनाऊंगा. मैं ऐसा नहीं बनाऊंगा कि कोई आपको ये बताए कि आपने कुछ करवाया है. लाइक अगर आपके फेस में जो आपका नोज़ है उसको ज़्यादा अच्छा बनाना चाहिए, मैं आपको किसी मॉडल या किसी फिल्म स्टार का नोज़ आपके नोज़ पे बना दूंगा तो इट वोंट लुक गुड टू यू. तो आपके फेस के साथ जो सबसे ज़्यादा मैच आपके टोटल बॉडी में, मैं ऐसे ही मैं करता हूँ. आई ऑलवेज ट्राई टू मैच विद द अदर फीचर्स ऑफ योर बॉडी और अदर शेप एंड अदर कर्व्स ऑफ योर बॉडी. तो आई नेवर गिव द 100% एक जगह पे, ऐसा नहीं वो 100% होता है, बट दैट इज टू मैच विद द अदर पार्ट ऑफ योर बॉडी. तो ऐसा पता नहीं चलेगा कुछ करवा के आए हो, इतना पता चलेगा आप कुछ अच्छे लग रहे हो. सो आई ऑलवेज से टू माई पेशेंट कि मैं इतना चेंज नहीं दे दूंगा. इट इज पॉसिबल, बट आई वोंट गिव दैट टाइप ऑफ चेंज. आई विल मेक यू अ नेचुरल मोर ब्यूटीफुल. सो दैट इज माई.
So you're like an artist. Agar, for example, I am coming to your clinic and I'm like not sure what I want to get done, but I just keep my face in front of you and ask you, Dr. Parikh, what do you think will make me look best? So what will your answer be?
नॉर्मली मैं मेरे पेशेंट को सबसे पहले यही बता कि आप सच में अच्छे लग रहे हो, कुछ करवाने की जरूरत नहीं. फर्स्ट आई ऑलवेज से दिस कि आपको सच में कुछ करवाने की जरूरत नहीं. अगर करो तो इतना थोड़ा सा, आई ऑलवेज सजेस्ट कि भाई इतना माइनर आप चेंज ला सकते हो, तो दैट विल लुक डेफिनेटली गुड. डोंट गो फॉर अ मेजर चेंज. बट
So
जो आपका
you
है,
basically offer your patients a subtle change,
Yes.
not a drastic change,
Yes.
so that वो उनको घर वाले भी ना पहचाने फिर.
या सेकेंड
Yes.
थिंग व्हाट आई से कि उसका प्रोफेशन क्या है. जैसे मेरे पास पेशेंट केम फॉर लाइक लाइपोसक्शन एंड दे के मुझे टाइट फ्लैट एब्डोमेन दे दो, टमी टक कर दो. तो आई ऑलवेज से कि ऐसा नहीं है, आप मॉडलिंग करने वाले हो, आप क्या कर रहे हो. इफ़ यू आर अ हाउस वाइफ, इफ यू आर वर्किंग इन अ गुड कंपनी, यू वांट अ कॉन्फिडेंस, देन इट शुड बी लाइक दिस, नॉट लाइक एब्सोल्यूट टाइट फ्लैट एब्डोमेन. आपको कैटवॉक नहीं करना है, आपको क्या करना है, दैट वी शुड थिंक. देन आई मेक देम, मैं कन्विंस करता हूँ कि दिस इज गुड फॉर यू. Talk to his husband or his family members, and then I just convince मैं उनको ये करके, आप नेचर के साथ रहो, नेचर कभी आपको धोखा नहीं देने वाली है. तो नेचर के साथ रहो, थोड़ा सा अच्छा कर सकते हैं, ये लेवल पे करो, दैट विल लुक नॉर्मल एंड अच्छा रहेगा.
No, I think you said it right. Okay, you know, some of the ladies, they are like, no, I just want pura perfect, like a model kind of a figure. And you said it right कि आपको cat walk नहीं करना है, आपको cat को walk कराना है. So you are perfect, and you know, you want to be like happy, healthy, and looking good at the same time, but you don't have to go for those drastic kind of measures.
Yes.
बट एंड में अगर आप कोई भी मैसेज देना चाहते हैं हमारे दर्शकों को, प्लीज़ गो अहेड.
I would say only one thing, कि now the medical science is इतना develop हो गया है कि now definitely you can go for a cosmetic surgery, because these are not a requirement. ये शौक है. आपके कबाट में, आपके कपबोर्ड में 10 ड्रेस पड़े, 10 शूट पड़े, लेकिन आप और भी 5 लाते ही हो. इट इज़ जस्ट लाइक दैट. तो आप एक शौक कर रहे हो, तो सच में एक नॉर्मल लेवल पे रह के करना ही चाहिए. नाउ देर इज़ वी हैव अ गुड इंफ्रास्ट्रक्चर, medical facility, and now we work in a team. We always take advice of physicians, surgeons, and our anesthetist before surgery for your maximum benefit. So now for certain cosmetic surgeries are definitely required, and that you can do definitely.
So quickly, I just wanted to ask you, we're talking about cosmetic surgery, but is there anything like अगर किसी का कोई health related issue हो and they can't do it, is there something like that too?
Yes, we always go for a medical checkup before surgery. So there should not be a certain major medical problem. The minor is like controlled diabetes or a controlled blood pressure. You are on that medicine, it is fine. That is not a problem. But if anything, any problem in your reports, then we always take advice of a physician. And once physician advise them about, and then we can go for a surgery. But definitely, it's now the cosmetic surgery is very well advanced, and the results are definitely encouraging. So now we can go for that surgery.
And thank you so much, and wishing you all the best. And definitely, मुझे लगता है 4-5 साल में I'll see you too.
Thank you very much to ITV Gold, and definitely Padma Shri Sudhir Bhai Parikh, and to all the members of the ITV Gold crew, and thank you very much.
Thank you.